And good morning. It is March 28, 2024. I'm Dr. Deuk Majin, and here with Dr. Davis and Luis, and we are going to be performing a right piriformis muscle release. This patient has horrible back pain, had it for a while, and in the process of dealing with his back pain, he has basically bent over and twisted in such a way to tear the muscle. Shot. So the muscle attaches from the sacrum, here you go, over to the hip. Now the sacrum is your tailbone, and the sacrum, the beginning of the muscle, we call it the origin of the muscle, the piriformis muscle, is a big fan-shaped muscle. It's big as your hand. And then when it runs laterally towards the hip, I would dock it right on the greater trochanter, right on the posterior tubercle. Let me know when you feel it. So the muscle then attaches laterally to the top of the hip bone, and specifically a thing called the greater trochanter. You can look it up on the internet. And there's a piece of bone sticking out on the greater trochanter called the posterior facet. And that's what we're aiming for. And Jordan, can you see, just show that right there. Show us the posterior facet. You see it looks like a little mountain on its side? Yep. That's the posterior facet. That's where the piriformis muscle attaches. Now, we've treated piriformis syndrome for many years. 20 years. We treated it with shots. And the shots, basically, I think you were past the, feel this, go up and down there. Feel the bony ridge?
Actually slid off.
Right here, oh, here, go. Too deep, too hard. It's lateral. It's right there. Don't change the direction. Aim a little lateral. If you're going medial to it, and then you're not able to go lateral and come around the back of it. Do you feel it or not?
No, it's
Right here. Try this. Right here. Don't change the orientation. Now go up and down and tap. Feel it?
as soon as I go to tap it, it falls off.
Because you're going too medial. You're aiming your tip medial. You got to stay lateral. Let me have it. Right here. Here, I'll hold it. You just move it up and down. Right here.
Yeah, I feel it when it's there.
Yeah. So all we got to do, let me have the coker. Hold on. Give us a second. We're getting in position here to do the procedure. We're already down to the place where we need to be. Shot? Uh-huh. You can see how the tip is sitting right on that little mountain. All right, I'm just going to go ahead. Now, what we're doing is we're releasing the muscle from its insertion at the top of the trochanter. And I'm using the X-ray machine to navigate. So I want to be there, but I also want to be a little higher up. You hear that? Yeah. You can actually hear the fibers snapping. And we're using plasma to do this. He's moving just a little. The good news is there's really nothing here in this area that you can harm if you know what you're doing. All right, done. I've gone through all the fibers. I'm just going to check my positioning. Shot. Now all this is being perfect. All this is being done with a small 4mm incision. And now I'm at the back of the femur, the femoral neck. You never want to go past the femoral neck right there. I'm sitting on it with my tip of my probe. But yeah, no, we're done. I've already done the release. It went great. A little bit left there. Yeah, I mean, it feels like little strings on a guitar. Any questions? So this is a Deuk spine piriformis release. We pioneered this particular technique. I did. And we've been using it with great success. Done. Let me show you the incision. Do we have any questions, Henry?
Yes, one question from Samir on YouTube asking, Doc, which level gives the two shoulders pain in the cervical?
Which level is the...
Which level gives the two shoulders pain in cervical?
Oh. It just depends on what's causing the pain. If it's facet pain, it could be 5, 6, 6, 7, 7, 1. If it's disc pinching the nerve, then it would be higher up, like C3, 4. So it just depends on the source of the pain. All right, hope you enjoyed watching our Piriformis release at Deuk Spine. This is, folks, I'm going to tell you right now, this is a major cause of chronic back pain, and it goes underdiagnosed. Most doctors have no clue that it even exists. So patients are suffering with this horrible top of the buttock pain, and they're not able to get relief, and every time it feels better, they go out and they do something and re-injure it, because the muscle never really heals. And this procedure gets rid of that pain permanently. It's only available at Deuk Spine Institute. So come to our website, check us out, and do an MRI review, and we can help you out. Any other questions?
No current questions.
Have a wonderful day. We'll be back later.